I'm going to talk briefly about sexual orientation, something that most of you in the room probably think you have a pretty good handle on, but this can actually be sometimes a little bit confusing from what our traditional thoughts are on. So we're taught the Kinsey Scale, which is almost 100 years old. It's been from the 1930s, 1940s, where they did some of the original research, and they basically gave you a number 0 to 6 based on what your sexual attraction was, whether that was same sex or opposite sex. But what we know is, even though this is somewhat of a graded scale from 0 to 6, maybe some days you feel like a 4.5, and another day you may feel like a 6, so it's not quite sure where this is going. And what we've come to understand more and more is, like everything else, as far as gender identity, sexual orientation, gender expression, these all can be a very fluid thing. So there's not always a specific number or identity that you can always assign to that. So I think it's important. I love this gingerbread person model because it really illustrates how complex and how much of a scale that all these different type of things are, whether it's gender identity, gender expression, biological sex, sexual orientation, who you're attracted to. It gives a sense that, not very many of it, some people vote kind of the straight party line, but a lot of us are kind of a mixed ballot when it comes to those type of things. So if you look at some of the numbers, this is from the Williams Institute that estimate about 3.5%, and the CDC has very similar numbers identify as gay, lesbian, or bisexual. The transgender number is smaller, as you might imagine, and this is probably underestimated, especially given the numbers that we just heard. And in the 2010 census, about 500,000 same-sex couples in the United States, distributed in 99% of the counties. It's not clear if sexual orientation and same-sex couples are going to be included in the 2020 census. That's a political debate. But it's important to understand that sexual identity does not necessarily be the same as sexual activity. So even though 3.5% of people may identify, they have as their sexual identity being LGBT, the flip side of that is about 8.2% have reported having some same-sex contact. So if you look at the fact that about 6% of us have had appendicitis in our lifetimes, so having a same-sex encounter is a little bit more common than having appendicitis. And I bet there's some people in this room that have had appendicitis. Just saying. So it gives you a sense. I think people know. And then 11% have some degree of same-sex attraction. So again, this is not something that is uncommon. It's going to be ubiquitous. You're going to see a lesbian, gay, bisexual, or transgender patient on every single shift. And words matter. When you go in, we talked a lot about this in our small group, and I suspect every small group did, about what exactly, how do you approach people, and, something that may be sensitive. And your level of discomfort may also be masked in some of the actions that you take and some of the words that you say. And it's really important when you're trying to, in that short time that we have, to establish a bond with patients, to make sure that you are using terminology that's not offensive. And sometimes that can be more difficult if you're not used to that terminology. So the word homosexual, although may be clinically active, if you walk into somebody and say, oh, I hear you're a homosexual, that does not particularly come off as the best way to do it, right? So, saying gay man, saying lesbian is certainly a much better way to approach that. The term sexual preference, although it's a lexicon, I guess, in our society, that people say, what's your preference? It's kind of like, I feel like I'm going to have a latte or a tea or a Diet Coke this morning, right? It's not a preference. There's no scientific evidence that says that it's a preference, and people make that choice. So it can be quite offensive to some people who are lesbian, gay, bisexual, transgender, just because of the fact that it seems like you're making a choice. So sexual orientation is certainly a much better term for that. So in summary, lesbian, gay, bisexuals are very common. You're going to see them in every single shift. Appropriate communications and terminology matters. It identifies you as an ally, someone who's not being that judgmental. The experiences that Bruce talked about earlier are not uncommon. Some of them are a little amusing, some of them are pretty horrifying, but they're not uncommon that a lot of people who are lesbian, gay, bisexual, transgender have experienced, including myself. So having somebody come in and make an effort to make a appropriate terminology, make an effort to have that doctor-patient relationship and that trusting doctor-patient relationship is incredibly important. It's also incredibly important to know about disparities and challenges for lesbian, gay, and bisexual patients, because we ultimately all want to provide equitable care. And my residents will know this picture is a year old. I didn't think you would necessarily come, so I was lazy and tried to get away with it. But this is our residency a year ago.